Hi, my name's Yvette Miramontes. I'm a PA. I've been a PA for almost 20 years. Been working in aesthetic medicine for that long. Today I'm going to be talking to you about one of my favorite procedures, which is threads. And I'm going to be talking to you about Viola, which is definitely one of my favorite thread companies to use. Okay, so this is my setup generally when I'm going to be doing my threads. I like to have my antiseptic and my gauze. I have quite a bit of gauze on my tray because if you get a lot of bleeding, you don't want to have to fumble around for it. So I have gauze that's wet. I pre-wet it with a little bit of my antiseptic spray, and then I have dry gauze. I have my scissors and my forceps or tweezers. I have my marking pin so that I have an idea and the patient has an idea of where I'm going to be placing my threads, and so I predetermine where my vectors are. I use typically 5 or 10 ml syringes when I'm going to be injecting the lidocaine throughout my vectors. My entry points, in order to make it more comfortable for the patient, I typically use a combination of Lida with epi and bicarb in order to bring down the pH and the patient's a little more comfortable. As far as bicarb to Lido ratio, I generally use 0.1 or 0.2 of bicarb, and the remainder will be the Lida with epi. If my patient is not a bleeder, I tend to do lidocaine solely when I do the 5 ml or 10 ml of lidocaine in my actual vector. Some providers do injections only. For me personally, I just find the long cannula to be a little bit more comfortable for both the patient and I. The other tool I need is my 18 gauge needle, because that's going to open the entry point of my port site. And then, of course, my threads of choice. Depending on what area I'm treating, I choose different threads, and I like to have them out so I don't have to go looking for them. So we'll be looking for vectors of where to place the thread in order to get her most appealing look. I'm going to hand Sandra the mirror so she can tell me what she's comfortable with, because I can do the thread lift where it's extremely exaggerated, which my younger patients tend to like, or I can do something a little more subdued. It just really depends on the patient's need and what they want to look like. So I'm going to hand you the mirror, hun, and I want you to hold this for me. So we have a couple different options. When I go in the center, we just have medial lift. When I go along the sides, we get a little bit more drastic. Do you have a preference you'd rather me do here, here, or both?
Both.
Yeah, okay.
Right. What would you think?
I think it's pretty here.
Okay.
The lateral brow, I think it gives us a nice widening, more space for eyeshadow.
Okay.
Okay. Perfect. And I always have something to mark the patient with. Okay. Perfect. And I'll be doing the same thing on the other side. She has a little more tissue on this side, so she may get a little bit of bunching here initially, but it'll release and relax. Okay. And I'm going to do a little line here. Smile. I don't want to cross this line to avoid changing her expressions. Smile. Perfect. And you can relax. And I always pull on the patient's tissue because not everybody is exactly the same. And I just want to see where I want to place my thread in order to give her the biggest lift. She's unhappy with her jowls. And oftentimes patients think that if I pull them back, those go away. But they go away, but it also distorts the lower face. So I'd rather lift her a bit before I start addressing it from here. Okay. Relax your head back, hon. I'm just going to clean her off a bit. A little pinch. The numbing aspect of the treatment is definitely the most uncomfortable. The epinephrine and the lidocaine are a little acidic, so the patient may feel some discomfort. I do put bicarb in my epi-lido just because it kind of tailors the pH a little bit, so it's not so acidic. Sorry, hon. And do the same on the other side. Some providers will continue with the needle and numb their whole area with just individual needle points, but I like using cannula, which is what I'm going to use next. I'm going to relax her a little bit and recline her back a little. Perfect. Can you turn your head for me just a bit? And then I'm just going to pinch a little bit and make my little entry point. Just go straight down. The pinching makes it a little safer when I'm around this orbital area. I don't want to leave her too bruised up. And it's near but not on my markings. I don't want to insert my needle where my marker is. And you can generally tell that's your entry point because of the blanching. And now I'm going to switch and do my cannula. You want me to recline you a little more? Are you uncomfortable?
A little bit.
Okay. Better?
Yes.
Okay. little bit of a tug. And you can inject Lido as you go in to make it just a little more comfortable for them. I never use more than 0.1 ml. Otherwise, you're going to just cause a whole lot of fluid. I'm going to do a little bit of Lido. You're doing great. The numbing takes the longest, but it's worth it because then the patient's more comfortable during the procedure. And then this preauricular area tends to be sometimes a little challenging to get through because there's a lot of fibrous tissue there. And if you have a patient who's actually done a facelift before, a lot of the scar tissue is in this area. It's not impossible to do, but it is going to require more time and a little more muscle. Okay, so the numbing's done. And this is the 18100. And the 18 just lets you know that it's a little more robust. It's a little thicker. Might feel a little weird, hun, when I get into the scalp, okay? You okay?
Yes.
Just a little bleeder here. I'm not going to go back into that same region. I'm going to wait for it to clot a little bit before I go there. Like I said, it's a little more fibrotic right here, so. A lot of my threads patients love their threads so much that they come back for more. Once I know whether my patient is prone to bleeding, sometimes I make the decision to add epi, which will cause some vascular constriction to the actual lidocaine that I put into the scalp, just to minimize this amount of bleeding. She's doing fine. Okay. I'm going to have to go back in here because I want it to be a really nice lift. So even though she bled here, I'm going to do this. You okay, hon?
Mm-hmm. Yes.
And on the ones where I have two threads, I'm just going to kind of twist them a little bit. It's not necessary, but I want it to just be a little reinforcement. And sometimes I'll even go so far as tying them off, but on her I'm just going to leave it as this. And we're just going to repeat the same thing. Some people like to leave the threads in and they don't actually cut or pull until they have both sides done. I personally rather just add to whatever side looks like it needs an extra than leave threads out. I'm doing my entry points. I'm going to pinch a little bit. You feel that a little?
Mm-hmm.
Can you feel that?
Mm-mm.
Okay. The lidocaine is always the worst portion of this. Once they're numb, it's okay. Perfect. You doing okay, hon?
Yes.
Okay. One more. Thank you. Okay. All right, hon, I'm gonna stand right over here. The most important thing when you're doing these twists and your entry points is to making sure that you're not getting any hair. The last thing you want is hair in your port.